There's a lot made about the ideal way to breathe. A lot of times it's actually not based in science, but based in opinion. Here's a nice way to think about breathing. If we're going to talk about breathing, you can't start this conversation without talking about the diaphragm. As you take a breath in, the diaphragm descends or comes down. As the diaphragm descends, you get contraction of the diaphragm pulling the central tendon down. When this happens, you get proportional eccentric activation of the entire abdominal wall along with lower rib cage expansion. Now, when we talk about the abdominal wall, everyone thinks about just the transversus abdominis. But the transversus abdominis is just one part of the abdominal wall, where we have the rectus abdominis, the internal oblique, and the external oblique. If you can do this correctly, there's a ton of advantages of diaphragmatic breathing. Here's the drill that can help. Start with your hands sitting in your lower abdomen and try to breathe into your hands as you feel expansion of the entire abdominal wall. From here, start to create some outward pressure and stabilize your core as you lift your legs up and get into a dead bug position. Once you've mastered this, you can incorporate leg movements while stabilizing the core. This will change your breathing because your diaphragm is going to be descended and you're going to have outward expansion of the abdominal wall the entire time. Some people call this breathing behind the shield, in which your core or your abdominal wall is the shield protecting your low back, and you're able to move your hips without compensating in your lumbar spine.